Well, since the Affordable Care Act, better known as Obamacare, became law, it has received challenge after challenge, and even more so under the Trump administration. How much of this will actually impact the medical care that you and your family will receive?
Joining us this morning is Rob Fuller, co-author of the book From Obamacare to Trump Care, Why You Should Care. Good morning.
Good morning. How are you?
So we know that last Thursday, there's your book, Trump signed an executive order that was easing the strict requirements that regulated health insurance under the ACA, Affordable Care Act. Tell us about the particulars of what they're calling now these skinny policies. How will they impact pre-existing conditions, premiums, that sort of thing?
What it will do, Jessica, is it will draw off healthy, mostly younger people from the existing insurance markets into these low-cost, low-benefit plans. And the people who are left in the existing insurance markets will be chronically ill, and the expense in the existing insurance markets will probably skyrocket. And the people who get the low-cost, low-benefit plans, if they do become sick or if they get in an accident and they show up at the hospital, they may find out that they only have $100 a day hospital coverage. So those are the kinds of plans we saw before the ACA in the mid-2000s. So I think that you're going to have a rerouting of people from the more traditional insurance to these skinny benefit plans, but it's going to take a year or so before they get on the books. But that's what everyone anticipates.
And to be clear, if you have a pre-existing condition, right now your premiums are at a certain level. Under this sort of situation, if you have a pre-existing condition, what we're told is that the premiums could skyrocket and make it just unaffordable. Is that your analysis as well?
It's quite possible. It depends how many people migrate out of the traditional insurance and off the exchanges into these skinny benefit plans.
Okay. Earlier this month, the Department of Health and Human Services issued new rules making it easier for employers to withhold birth control coverage on religious or moral grounds. How is that going to work, or how is it working?
Well, there are a number of actions the Trump administration has taken to what they call shore up the religious choices of persons and entities. And a business could, if it had a compelling reason, refuse under the Obama administration to provide birth control. Now it is a lot easier test of what constitutes an ethical choice or a religious choice by a company. Basically, they just sign an affidavit saying we object, and then they don't have to provide that benefit anymore. And this falls on the heels of their truncating the access to healthcare.gov and eliminating navigators that would help people sign up for the insurance next year, and closing down the open enrollment period this year. So it was among a series of actions taken by the Trump administration to greatly reduce the benefits, especially in birth control for women.
Also, Rob, last month Congress missed a deadline to extend funding for the Children's Health Insurance Program. It's also known as CHIP. Explain to us what that program does, and then, how things are going to change now that they missed that deadline.
Well, hopefully Congress will get their act together, but so far they haven't. CHIP is a very useful insurance program that backstops families whose children have leukemias and cancers and very serious childhood illnesses that cost a lot of money to treat. About 9 million youngsters nationwide are under this program to treat these kinds of diseases. Now, the plan expired on September 30, and Congress was expected just to roll it over, but they didn't. There's been a fight in the House with the two warring factions of the Republican Party basically disagreeing over how to pay for it. Republicans even proposed a new tax to pay for the CHIP program, and that hasn't been resolved yet. It passed through the Senate pretty well, but the House stalled it, and we're hoping that by the year end it will be funded again through general appropriations, but already Minnesota and Utah are run out of money on the program. Minnesota over the weekend got an emergency cash infusion to try to keep care going for youngsters who are undergoing this kind of treatment.
Wow. Here in California, Governor Jerry Brown recently signed a bill into law that would require drug companies to provide more transparency in how they set drug prices. How's that working?
Well, the real part of that bill that will have an impact on the market is that drug companies were offering coupons to have consumers kind of not have a difference between brand and generic, where there's a generic, and the coupons offset the cost of the brand. but that would cost the state and insurance companies a lot more to pay for the brand when the generic equivalent was available. The bill outlaws that coupon practice and makes it transparent to the consumer that you may be choosing brand, maybe it doesn't cost you much, but your insurer is paying $300 or $400 for that pill that might only cost $10 or $20 if you got the generic. So it's to provide the information to the consumer and to eliminate the coupon practice so that people make better choices with their pharmaceutical spend.
Rob, thanks so much for being here this morning. We appreciate it. Once again, the book is titled From Obamacare to Trump Care. Rob Fuller is a partner at Nelson Hardiman, a law firm for healthcare providers. For more information, you can check out the website, TrumpHealthCareBook.com. Thanks again, Rob Fuller.
My pleasure.
Good to see you.